Welcome to AMGA's Executive Pulse with Dr. Brian McDonough. Each episode brings you candid conversations with the leaders innovating in healthcare delivery. Healthcare moves fast, so don't miss a beat. Let's dive in.
Hi, it's Dr. Brian McDonough, and welcome to Executive Pulse. I have a really exciting program today. I'm honored to have with me Dr. David Nash. He is the founding Dean Emeritus of the Jefferson College School of Population Health, as well as the Grandin Professor of Health Policy. David, first of all, welcome to the program.
Thanks. Great to be together. Really good.
It's really interesting. We've talked many times over the years through TV, radio, all sorts of things, even socially and in academic settings. And I'm always amazed with how much you have done and how much you've achieved at spreading the word about the importance of population health and more or less serving as a role model for so many. So let me start there.
Wow.
Explain population health as a concept, and also why, for you, this was such an important area for you to focus on.
Well, first of all, Brian, great to be together. And folks who are outside of the Philadelphia marketplace, you've got a radio icon here, and it's not me, it's Brian. So fantastic to be together. So look, Brian, it's really amazing. I have been at Jefferson for 35 and a half years. I'm about 40 days or so from retiring from the university. But look, population health. So that was my third job at Jefferson, was being basically assigned the role of becoming the founding dean of the first college of population health in the whole darn country.
Wow.
It was being in the right place at the right time, quite frankly. The university leadership at that time, our former president, Robert Barchi, who went on to become the president of Rutgers University, and the board and the leadership and the strategic plan. I mean, I had a tiny piece of the action here, but the real credit goes to the leadership now, back in 2008, when the university said, okay, time to expand Jefferson. Let me just give you a little bit of context here. When I got to the university and the medical center 35 years ago, I mean, we were one hospital and three colleges, about 1,100 students. I mean, today, Jefferson University is 10 colleges, 8,600 plus students. I mean, we're bigger than Lehigh University, but you don't think of us necessarily as a big university because we're such a large 33 hospital, $15 billion delivery system. Okay, now to answer your question. So look, in 2008, let's remember this is 2 years before Obamacare, right? That's March of 2010. So when the university said we're going to open up a college of population health, I spent 2 years on our campus proselytizing what the heck is population health and why is it different from public health? So let me give you our sort of stock answer. Look, the public health community has done an awesome job, right? Clean water, clean air, wear a seatbelt, stop smoking, get vaccinated. All those things have contributed far more to improving health than 33 hospitals will ever hope to achieve. But population health, we put that just above public health. Population health is supported central pillar is public health, but it also looks at, hey, what does all this cost? So the health economics. Hey, are we doing it safely? So healthcare quality and safety. And then, hey, what are the public policies? So for us, population health is public health, health economics, quality and safety, and health policy, all rolled into one. And we could quibble, but let's also give credit to Dr. David Kindig, my good pal, still alive and working at the University of Wisconsin. So, Brian, in 2003, David Kindig wrote a paper, ironically, in the American Journal of Public Health, defining population health, because what his view was not only what I just described with the pillars, but he added language in 2003 about the social determinants of health. And you and I know, and our listeners and viewers know, hey, it's all about poverty, lack of education, crime. These are the things that are real determinants, sadly, in our country. What's the research show? Look, the social determinants drive 85+% of your health, most especially in our great city of Philadelphia, where fully 20% of the population lives below the poverty line. So
Boy, you
despite
bring
that,
up, so many key points you're bringing up, because if you think about it, back in 2003, although we were aware of it,
right,
there weren't that many people looking at all those other issues, the importance of a zip code, and that stuff's being studied.
yes. So this is all, of course, way before COVID. So Kindig deserves a lot of credit to bring this to the fore more than 23 years ago. Personally speaking, Brian, I was in the right place at the right time. The university said, well, we're going to take this medical school department at what was then Jefferson Medical College, one of the largest private medical schools in America. We're going to take your department. We're going to take it out of the medical school. We're going to put it on its own 2 feet. And we're going to, by virtue of the power of the trustees and education, we're going to grant you degree granting power. And you're going to build, with this little nidus, you're going to build a college of population health. And essentially, that's what happened. And it was, heady for me. I was a med school department chair. I already had tenure. I was at the pinnacle of what I thought, academic medicine was all about, for all its warts. And then having the opportunity to become a dean, well, that was pretty cool. I had no idea really how to do that. That's a separate story in and of itself. But I recruited great people to help me. And with a real team effort, we built this college with, bubble gum, a Band-Aid, and some rubber bands, and put it all together, got it off the ground. We went virtual in 2009. There was no Zoom. We were sort of figuring it all out. So it's a great story. And I give, again, a lot of credit to our leadership. But population health is just public health on steroids. Maybe that's a good way to think of it.
What a great way and a great transition point, because one of the things, we have obviously a lot of executives who are watching Executive Pulse. AMGA is chock full of leaders. And I know you have over the years played a very important role.
AMGA Foundation for many years. I have a huge amount of respect for Dr. Jerry Penzo, John Kennedy. I mean, a great team, really great team.
And so as a transition, one of the things you said in explaining, and I know you're very humble in how you explained it, but you did obviously had a huge part in all of this. But one of the things you said was you learned as you went along. And I think that's important. Talk to me about that, because I found in my own career the same thing. Like you're thrust into a position and you take it and you're like, how the heck did I ever get this position?
Yes.
And what am I going to do next? And you tell me how you did it, how you educated yourself and embrace these challenges.
Great. Let me give you the personal piece first, and then the more professional piece. So the personal piece was, when the university said, we want you to do this, I grudgingly said, well, okay. I came home and my physician executive wife said, what the heck did you just do? Why would you want to do this? And what's population health anyway? So, it was a humbling experience. So from the personal perspective, it was a little bit of risk taking, but basically I was made an offer I couldn't refuse. Like, you're going to do this or else. Okay, that's the personal piece. The professional piece was, all right, well, now we really got to work hard to figure out what's important, what's the curriculum, what's the skill set we want these graduates to obtain. But I was always focused on building leaders for the future, whether it's in a medical school, population health, pharmacy, nursing. To me, great leaders, their number one priority is to train leaders for the future. So I embraced that. Then I had to learn what this was all about, because I am not a public health trained expert. I'm not an epidemiologist, not an infectious disease expert, nothing even close to it. I'm a primary care internist. So from my clinical training, I appreciated the concepts. So Brian, we went about organizing and editing the first textbook in America on population health. I mean, how could you have a college without a textbook? Also, I was editor-in-chief for 25 years of our journal, Population Health Management. So in the process of editing the textbook and editing the journal, I mean, I read basically every day for years from work from our colleagues from all across the world. And so I was in the catbird seat, not that I was doing all this research, but I was the funnel, the common pathway to get all this stuff. Organizing the textbook with our publisher, Jones and Bartlett, was a pretty amazing experience. Getting experts to write the chapters, editing it, getting the papers through the journal process. So I had exposure to all kinds of fantastic thinking. Now, that's all the good news. The not so good news was the public health community. There was a little bit of pushback. What's population health got to do with it? Public health been doing a good job. True. But if you look at the research evidence, at least in academic medicine, most schools of public health are sort of a second-class citizen, treated as a second-class citizen, sadly. And this goes back to 1965, birth of Medicare, all the funding to build hospitals. And so there was a schism, a chasm between clinical medicine and public health. So population health, we tried to bridge this gap. So being a primary care doctor at a big medical university, well, again, right place at the right time. So summary, I was at the center of a lot of great information. I was drinking from a fire hose, Brian, especially for the first 4 or 5 years. And then Obamacare, which is another story, really gave us like a launch pad, because I could then stop proselytizing and get to work, because it was front page news. And it wasn't just, Nash saying it's important. It was the whole country was interested in accountability and transparency and, linking outcomes to payment. But we didn't invent this. It became public policy.
You talked about creating a succession plan. Obviously, you get to the point, you get to be our age, you got to start thinking of the future. Who's going to carry on the things we're doing? And you obviously, part of what you did is you got this going, but now you have leadership and others carrying it on.
Thank goodness. Yes. Yes. Well, I have a talent for picking talent. And if you're a dean or any kind of academic leader, you got to have that skill set. And finding talented people to join the team. I was basically, I made my research career in quality and safety. That's what I did. I mean, I've taught more doctors face-to-face the tenets of quality and safety. Basically, it's Brent James and then David Nash. I mean, 6,000 doctors face-to-face over 30 years when you do the arithmetic. That was my legacy. So we just saw that work. Population health is an extension of that. I mean, when you deliver care, you better make sure you're not harming anybody. Well, guess what? We have a long way to go in that arena. So that's another distinguishing characteristic in the pop health field. We recognize that waste in the system is driven in no small part by lots of variation and error. And you and I know what that means, right? Wrong drug, wrong patient, extend the length of stay, more visits to the doctor, not to mention the harm we've caused and all the rest. I mean, that's a gigantic area. So that is what I spent the first 15, 20 years at Jefferson working on. And then this opportunity to build Pop Health. So I had to convince a lot of people that we had, street cred in population health.
This is Executive Pulse. I'm Dr. Brian McDonough with my special guest, Dr. David Nash. You talk about you were a professor and you're teaching. Part of that, I think I can tell just by talking to you, it's in your DNA. You like to teach. Yes. And you like to educate. Has the fact that you are more or less born, or at least you've developed a skill for teaching, helped you in all the work you've done?
Yes, no question. So, look, I was super fortunate. A watershed event a long time ago was being accepted into this special program called the Robert Wood Johnson Clinical Scholars Program. So just to give 1 minute of history here. So the Robert Wood Johnson Foundation, of course, one of the nation's most important philanthropic organizations in healthcare, probably the top one. This program existed for physicians at that time, exclusively for doctors who had just finished their clinical training, to have a fellowship opportunity. And in my case, the fellowship was going to the Wharton School of Business on a full academic ride and being exposed to the top leaders in healthcare management at the Wharton School of Business. So the Wharton Health Administration MBA program at the Leonard Davis Institute on the Penn campus is probably one of the top 2 or 3 healthcare administration programs. So Brian, I did college, medical school, residency in Philadelphia in medicine. Residency ended on a Friday in June of 1981, 84. And that Monday, I was in the Wharton Business School learning about health administration. And so that really opened my eyes. I mean, looking back, going to business school 40 years ago for a doctor was way out of the ordinary.
Sure.
People criticize, what are you doing? You're not a real doctor. You can't cut it in practice. I mean, I got all of that.
One of the things I want to ask you, a few years ago, you wrote a book, How COVID Broke the System, I believe it was called, but it was and a very interesting read talking about that, which leads me to really the last question that I had on my docket of questions to ask you. And that is, where do you see the future? Like we talked about the system broken. Is it still broken? Is it recovering? Where do you see it? Where do you see it going?
But to answer your question, sadly, Brian, the system is still broken. I mean, sure, we learned a lot, but here's the punchline. When the dying stops, the forgetting begins. And this is true throughout history, throughout every war. When the dying stops, the forgetting begins. Meaning, look, COVID pointed out what folks like you and me and many of our listeners already knew, which was when you spend $10,000 a year on healthcare services per person versus $400 on the public health infrastructure, and then you have a global pandemic, what the heck do you think was going to happen? And what happened was it shined a bright light on structural racism, our lack of preparedness, a starved public health infrastructure. And then you add on top of that, American, our essential American notion of independence and lack of community and racism and poverty. It was a recipe for disaster, which is why America had 1.5 million dead. I mean, hello, total casualties in the Second World War were 500,000 in both theaters over 4 years of war. We had 1.5 million dead from COVID. Nobody wants to talk about that. That's what the book is about. America is unprepared, God forbid, for another pandemic. We have further starved the public health and population health infrastructure. What I have faith in is the leaders that we're training now for the future. And we have some amazing young people coming down the pike who we have trained and others have trained. So I have faith in the trainees who are going to help to fix what's broken. And I have faith overarchingly in eventually, paraphrasing Winston Churchill, we'll try everything and eventually we'll get to the right damn answer. But, today it's incredibly worrisome where we are all the way CDC, NIH, AHRQ. I mean, you name the organization, they're suffering. And we'll keep politics out of it. But the facts are we are in a dangerous, precarious public health position at this moment.
Well, there are important words from you, Dr. David Nash, especially knowing your history and how much you have studied and actually practiced in this area. I want to thank you for taking the time to join me on Executive Pulse. It's always an honor to talk with you. I always find myself learning something, and I hope our audience did as well.
Great. Thanks again for the opportunity, Brian. Great to be together.
Thank you for joining us for Executive Pulse. This podcast is brought to you by AMGA. For more information, please visit amga.org.